Welcome back to part 2 of the GI tract video. Today, we will focus on 5 foods to help cure constipation. We will also look at treatments for diarrhea. Let's dive in to see if we can fully explore this topic. Please remember, always talk to your doctor before you try any of these suggestions. And please don't forget to like, share, and subscribe. Thank you. If constipation has been slowing you down, the answer may be sitting right in your kitchen. The right foods can help soften stool, support healthy gut bacteria, and keep things moving more naturally. Here are 5 everyday foods that may help relieve constipation and support regular digestion. First, prunes. Prunes are one of the most famous constipation remedies for a reason. They contain fiber, sorbitol, and natural compounds that can help draw water into the intestines. A small serving of prunes or a glass of prune juice can be a simple, daily option if you struggle with hard, dry stools. Second, kiwi. This small fruit is a big helper for digestion. Kiwi contains fiber and an enzyme called actinidin, which may support bowel movement and digestion. Eating 1 or 2 kiwis a day has been linked with improved regularity in many people, and they're easy to add to breakfast or a snack. Third, oats. Oatmeal is rich in soluble fiber, which helps form softer, bulkier stools. It also feeds beneficial gut bacteria. Starting your day with a bowl of oats, topped with fruit or seeds, can be a gentle and effective way to support your bowel health. Fourth, beans and lentils. These are fiber powerhouses. They provide both soluble and insoluble fiber, which can help stool move through the digestive tract more efficiently. If you're not used to eating them, start slowly and drink enough water to avoid gas or bloating. Fifth, chia seeds. When mixed with liquid, chia seeds form a gel-like texture that can help stool pass more easily. They're also packed with fiber. Stir them into yogurt, oatmeal, smoothies, or even water and let them sit for a few minutes before eating. Of course, food works best when you also drink enough water and stay active. Fiber without fluids can actually make constipation worse. If your symptoms are severe, long-lasting, or come with pain, blood, or sudden changes in bowel habits, it's important to talk to a doctor. A few simple foods eaten consistently can make a real difference. Start with these 5 and give your digestive system the support it needs every day. Diarrhea is when stools become loose and watery and occur more often than usual. It is not a disease itself, but a symptom that something in the digestive system is not working normally. Most people experience diarrhea at some point in their lives, and while it is often short-term, it can sometimes signal a more serious problem. The digestive system normally absorbs water as food moves through the intestines. When that process is disrupted, too much water stays in the stool, making it loose. This can happen for many reasons, including viral or bacterial infections, food poisoning, eating something that does not agree with you, stress, certain medicines, or conditions like irritable bowel syndrome and inflammatory bowel disease. Diarrhea can come with other symptoms too, such as stomach cramps, bloating, nausea, fever, or an urgent need to use the bathroom. The biggest concern with diarrhea is dehydration because the body loses significant fluids and minerals. Signs of dehydration include dry mouth, dizziness, dark urine, and feeling very weak. In many cases, diarrhea goes away on its own within a few days. Drinking plenty of fluids is important, especially water and oral rehydration solutions. Bland foods may help if you can eat them, and it's usually best to avoid greasy foods, alcohol, and excessive caffeine until you feel better. You should seek medical help if diarrhea lasts more than a few days, is severe, contains blood, or is accompanied by a high fever or severe pain. It is also important to seek help quickly if a child, an older adult, or someone with a weak immune system has diarrhea, since dehydration can progress more quickly. So, diarrhea is your body's way of telling you that something is upsetting the normal digestive process. Most cases are temporary, but paying attention to symptoms and staying hydrated can make a big difference. Diarrhea is one of those problems that feels minor until it hits you. The best treatment is usually not a strong medicine initially. It is replacing the fluid and salts your body is losing. For most people, the most effective treatment is oral rehydration solution, or ORS. It helps prevent dehydration and is better than plain water alone because it contains the right balance of sugar and electrolytes. If you have mild diarrhea, keep drinking small amounts often, even if you do not feel thirsty. Clear soups, diluted juice, and ORS can help. Eat light foods if you can tolerate them, such as bananas, rice, toast, applesauce, crackers, or plain potatoes. You do not always need to stop eating. In fact, staying nourished can help you recover faster. For adults, over-the-counter medicines like loperamide can reduce diarrhea in some cases, especially if it is from a minor stomach bug and there is no fever or blood in the stool. But these medicines are not for every situation. If an infection causes the diarrhea that the body needs to clear, or if there is bloody stool, severe pain, or high fever, do not use them without medical advice. If diarrhea lasts more than a couple of days, or if you are caring for a baby, an older adult, or someone with a weak immune system, medical attention is more important. Signs of dehydration include a very dry mouth, dizziness, little or no urination, extreme weakness, and confusion. In children, watch for no tears when crying, sunken eyes, and fewer wet diapers. The best treatment depends on the cause. Sometimes it is a virus, and time is the cure. Sometimes it is food poisoning, medication side effects, or an infection that needs specific treatment. Probiotics may help some people recover a little faster, but they are not the main treatment. So if you want the short answer, the best treatment for diarrhea is fluids first, especially oral rehydration solution, plus rest and simple foods. Use antidiarrheal medicine carefully and get medical help if symptoms are severe or persistent, or accompanied by warning signs. We will have to stop this video here and continue the GI tract video next time. Thanks for watching. Please like, share, and subscribe. Thank you.